Are we good to go? Very good. I am going to start. Hello, everybody. My name is Hale Bridi. I'm a member of the board of the Partnership for Transparency, which we refer to as PTF. I want to thank everyone for joining us from all over the world. We are very excited to be here, and this is a very important event for us, and we usually attend it always in person. So we are very grateful to the OECD that they have allowed us to be there virtually through Zoom, but also to actually organize this session, which we are very excited about. So this session is about COVID-19 and its aftermath. And as we all know, our governments, when COVID happened last year, our governments had to rush to find solutions for their populations, to buy PPE, to buy masks, to find ways of protecting their population in a big rush. So they paid very little attention to issues of accountability, issues of transparency, corruption, equity, things like this. So now, after a year of all this, we believe that we can take stock of what we learned from this experience, and how we can project it into this new stage, which is the stage of vaccination. And for that, we have a very nice panel gathered for you. We have one of my colleagues from the Partnership for Transparency, Vinay Bhargava, who is the Chief Technical Advisor at PTF, and who is going to set the frame for us, who is going to tell us about what potential roles CSOs can play in this area and what could be their role. Then after Vinay, who will make very brief remarks, we'll go to our three panelists who are actually on the ground, who have been working during the last year. So they have a lot of lessons to share, and who will also give us some recommendations as we roll out the future sort of stage of vaccination. And so I'm going to list them for you. I'm going to start with the lady, Akila Sivadas, who is Executive Director on the Center for Advocacy and Research in India. Our second panelist is Marla Nagaba, who is Head of Programs for Anti-Corruption Coalition in Uganda. And our last speaker is Pablo Secchi, who is the Executive Director for Poder Ciudadano in Argentina. So as you see, we've deliberately picked three very different countries of different sizes and at different stages of development. And as you will be able to see, our panelists are actually also operating at different levels in this COVID arena. One more on the policy side, one more on the sort of community side. So we have been really trying with the selection of our panelists to give you a full array of the experiences that are possible and doable. So without further ado, I wanted to pass on the floor to Vinay to start us off. Before that, maybe a couple of housekeeping issues. I would appreciate if you mute yourself if you're not talking. And if you have any comments or questions, please don't hesitate to write them in the chat. Even as they're talking, it doesn't matter, just anytime, go ahead and send in your questions in writing. However, if you want to raise your hand, I would invite you to do so during the Q&A session. So with that, I'm going to now pass it on to Vinay for his introductory remarks. Thank you. Vinay, over to you.
Thank you very much, Hale. Can you hear me all right? Can
yes,
you hear me
very
all?
well.
Yes, okay,
very
good.
clearly.
Thank you very much. Greetings to all of you. As you know, 2021 is the year of hope. We hope that we can all get back to socializing, working, traveling, and playing. Not necessarily in that order, but definitely get back to those things. These hopes can turn into reality if the virus variants are manageable and the governments do three things. First, governments need to equitably and efficiently implement the vaccine deployment, which has never been tried before among the adult population. Second, they need to spend with integrity the trillions of dollars of COVID response money they have allocated to address the health, social, and economic crisis caused by the pandemic. Third, the country's accountability systems and institutions need to check and explain what happened to the money that is being spent by the government. Can we trust the government to do these three things right? Can we leave it to trust alone? Well, we have no choice. The government is there. Government will do these things. But history and Agenda 2030 tell us that governments alone cannot deliver on the development goals and ambitions like the one we are facing now. It is wise for the governments to collaborate with civil society and the private sector. At the same time, it is also wise for the civil society to trust and work with the government, but verify, trust but verify how the government is performing on all those three fronts. This twin role of the civil society to be a public service provider, to serve the communities, to complement the government's services is enshrined in the Agenda 2030. At the same time, the civil society has the watchdog and advocacy roles. And these twin roles are the subject of this session. Our distinguished panel, which Hali has introduced, will share the reports on how they are balancing these two roles of servicing the communities, as well as in a complementary roles to the government, as well as performing the watchdog and advocacy roles. Before turning it over to them, let me share with you 6 proven pathways. If Rachel could please share the screen, because the question comes, how can the civil society do and what can it do? There are 6 pathways that based on PTF experience and all the research we have done, which are very relevant for helping civil society play these twin roles in the COVID-19 vaccine, as well as the vaccination program. I will not read the 6 points which are on the screen, but we'll just say that there are thousands of civil society organizations that are already engaging in one or more of these activities. And their stories are being showcased at a website which United Nations has created. And the 3 CSO partners from whom you will hear today are among the ones, those thousands who are making a difference. I'll come back to later at the end of the session to share with you a story of how this can be scaled and what can be done. But let me now turn it over to Hale with the request to proceed with the speakers. Over to you, Hale.
Thank you very much for setting out the 6 areas where CSO engagement is possible and welcome in this particular domain. But now we're going to move to the practitioners, to the people who are actually in the trenches and trying to get this done, and ask them to tell us very briefly in 2 minutes each, what was the response in their countries? And more importantly, how did they make a difference? What is the difference that you made on the ground in trying to address this? So what is your value added? We're going to start with our friend in Argentina. So Pablo, over to you for a very brief sort of indication of what happened in your country.
Thank you very much for this opportunity to tell about our work in Argentina. We believe that for the first time we have a challenge that unites all the countries of the world many times the challenges are different for our countries, but this time the challenge is the same for everyone. Speaking about transparency, for example, the challenge is to strengthen our purchasing system and make them effective, fair, and transparent. The country's response to the COVID crisis began with a series of restrictions of the movement of citizens and the beginning of a major public procurement plan to deal with the pandemic. Of course, this was necessary, but it also raised an alarm in us about the challenge in terms of transparency. That is what we do in Argentina. You know, we are the Argentinian chapter of Transparency International. Immediately, we respond to this plan of the government by setting up a public procurement observatory, informing the public about how the state was investing and whether it was being transparent or not. We did this by keeping track of all purchases from the state. We have the support of PTF, and thank you for that. And about what happened if we had not been there, possibly a series of irregularity would not have been known, and it would have not have been known about the amount of purchases and the prices paid by the government.
Thank you very much, Pablo. It's really important to highlight the just information, what a role sharing information can play. So thank you for that. Let's go to Marlon and talk about Uganda.
Thank you, Harry. Uganda's COVID response centered on like 6 major things. One, of course, institutional. Instituting a mandatory lockdown of the country, like most of the countries in the world, community awareness, surveillance and testing, case management, research and innovation. We have been trying out some locally made vaccines, logistical reinforcement, because COVID-19 found when our health system was virtually in shambles. In terms of our role has been mainly to monitor the huge investment of resources. Over $2.7 billion has been invested in Uganda's COVID response. So we are empowering citizens, first of all, getting information and giving it to citizens to empower them to monitor. That is one. Secondly, we're also encouraging citizens, educating them to follow the standard operating procedures that had been put in place by the government, and also providing alternative policies in terms of what was going on around the world in terms of best practices and what Uganda as a country could adopt. At different levels, we're also directly involved in the planning process for the resources at the district level, for instance, in Uganda, and at the national level with the central government, but also where issues emerged from the grassroots, we did flag them to the leaders, especially that were related to issues of transparency and accountability. But also, most importantly, CSOs were the single source of the most accurate information in terms of what was going on, because COVID-19 came with a lot of human rights abuses. We had expectant mothers dying because they couldn't access health facilities. We had people who were starving. So as civil society, we are the most accurate source of wide information that we are giving to the people through the national media, through social media, and through our grassroots communication channels. Without civil society, of course, we think it could have been a little bit more worse, because already the Auditor General's report in Uganda has come out showing that over $91 million cannot be accounted for in this small country. That's a lot of money. And we think that without our efforts, it could have probably been worse, given precedents from previous scenarios. Thank you.
Thank you, Marlon. I think beyond your role of information sharing, you actually managed to even pinpoint some amounts that were missing. And as you say, probably it would have been a lot more if you had not been there. Let's ask our friend from India, what was the experience there, Akila?
Thank you, Hadi, and thank you, PTF, for inviting me. I feel really honored to be part of this panel. So I want to start with what Vinay talked about, very crisp and pithy 6-point proven pathway. And as he said, we're already at it even pre-COVID and during COVID. what's important is playing that complementary. I think the more important is that salient role that CSOs play. And of course, the pandemic has shown in no uncertain terms, not only our ability, but our commitment to people. And this is an extraordinary pandemic, but in requiring extraordinary solutions. And no amount of money, power of pelf will help. You need people. And you need people with what we call the elements of courage, resilience, nimbleness, resourcefulness. And that's what people brought in. And like all other countries, India was no different. It was a choice between shutting the country in 4 hours, literally, and untold deprivation and distress to the people, or just bearing the consequences of large-scale infection with no preparedness and wherewithal to tackle it. So it's really a hard place at a rock. And they opted for the latter. They shut the country, promised everybody that all food and all essentials will be at the doorstep. But how? The country is locked down. There is no transport. There is no mobility. You can't go from one part to the other. Who will, do that, reach the doorstep? And that's where people stepped in and the CSOs stepped in, thanks to technology, thanks to WhatsApp and people. It all came together. We ourselves distributed for the first 2 months. We just distributed food to almost 500,000 households across 17 cities. But that is not enough because the infection started spreading. Deaths were being recorded, numbers were rising. And in fact, people were getting into what is called what we call a list, a ranking list. There were cities that were on top, second, third. And it was a matter of time when the crisis would catch on. So the fight back against the pandemic began. You won't believe it. A team of 115 women, community leaders, reached out to 100,000 people, surveyed them on their Google form within 6 weeks. Meanwhile, they brought in the health system. They brought it to their doorstep. They had everyone tested, or whoever needed to be quarantined, whoever needed to be, secondary contacts, primary contacts traced, all kinds of care and support. Within 3 weeks, they brought down death to 0. And within 6 weeks, they reversed the infection. They absolutely brought it down to a halting. And it was truly inspiring. And very clearly, the fight back is the moral of the story. That that's where people are most needed, and more pandemics are in the making, more crises in the making. Please start valuing people. Is the lesson.
Thank you, Akila. I mean, what we are hearing from the three of you is that first, your experiences were very different. You worked at different levels of information, from Pablo to you, Akila, who was really in the trenches. And not only you managed to save money, you also managed to save lives. And I think this is the lesson that we're learning from last year, and it's very laudable. And congratulations to you for this enormous impact, because you yourselves were not prepared for this. You had to sort of learn on the go and plan on the go. So it's really remarkable that you were able to achieve this. One of the issues we keep hearing about is the question of equity, and equity of access to resources, whether it's money, whether it's food, whether it's PPE or masks or whatever. And we know that when, usually it's the most vulnerable people who get the shorter side of the stick. So let's hear from you about what was the experience with lack of equity in your countries and how you dealt with it. And let's start with you, Akila, in India.
Yes, Hale. We've all along upheld the belief that the minute community gets command of information, then the rest of it just snowballs. And we did everything from using mass media to social media to what you call grassroots communication. So just about everything from wall writing, street plays, community meetings, mobile-based technology, low cost, mobile technology, what they call the IVRs, everything was used to put out information. What is this information? One is how to engage with the pandemic, but more importantly, to also, counter the myths and the misinformation. People become quickly prey to all of that, and they're not able to take decisions. They're not able to inform themselves. So to fight that back, and more importantly, what is this information without, asking for accountability? So use online submissions, get your grievance redressed, raise your voice against everything. Any kind of procurement that was happening, they were keeping track of. Any kind of distribution of PPE kits, sanitizers, they were keeping track of. Any kind of, shall we say, ill treatment in the health centers, they were raising their voice. There's nobody will, play with fire with such an informed and, empowered community. So that's the best way of, ensuring equity in more ways than one.
Yes, no, it's, I mean, you used the grassroots level to really share information, mobilize people so that they will go get what is available, what government is making available to them. What about you, Marlon? How did you manage that in Uganda?
Yeah, thank you very much. First of all, the biggest impediments, barriers to equity in Uganda, I can summarize them in three things. One was poor planning. That much, of course, much as COVID came abruptly for most of the countries in the world, but for us, the planning was still poor. Even when the COVID was here, the planning was poor. Two, we had misguided priorities because most of the money was being put in things like buying vehicles for government officials, like what is it called? Classified expenditure. That most of the money that we got for COVID went into classified expenditure when the health workers had no personal protective equipment. And then, of course, the biggest monster is corruption. Corruption and impunity, those are very big problems. So we find that much as COVID affected nearly most of the people, when it came to things like food distribution, only people in the cosmopolitan Kampala, that is the capital city, and the surrounding areas were able to get the food. When it came to issues of like stimulus packages and support, it's only the big companies that are connected to government that are receiving the stimulus support in billions of shillings. Yet the other companies and people were affected as well. They're not getting this kind of support. But also it brought out the other aspect of the income inequalities. The poor are being most affected. People cannot afford medical care. At one time, a bed, for instance, of oxygen, a bed with a ventilator and oxygen in Uganda cost around around $1,000 US, and very few people can afford that. So only the rich who could afford that. We had expectant mothers dying. We had people with chronic illnesses like diabetes and health complications and cancer dying because the transport system was shut down. But even now with the vaccination, you find that much as the government released the plan in terms of priority being health workers, before the health workers are vaccinated, we are having big people in government, in parliament, rich politicians. They have already jumped the queue. They're already getting the vaccines ahead of the frontline health workers. So what we have done, we have been engaging with the government to raise some of these issues. I'm glad that a few issues have been taken on, like for instance, the issue of refugees. Uganda has a huge refugee population of close to 1.4 million people. They are being considered in the next phase of vaccination and other marginalized groups as well. Thank you.
Thank you. Thank you so much, Marlon. Argentina, Pablo, very quickly, please.
Yes, sure. Sure, thank you for the question. We work on equity from an overview of the way the government approached the pandemic, observing how each institution carried out its work, and based on the fact that the way that the resources are bought and distributed affect especially the most vulnerable people. For us, equity is fundamental because, for example, the regular purchase of supply or, for example, vaccines in this moment especially affects, again, the most vulnerable people. We are challenged as in our aspect of our life to achieve the greatest equity and equality. We confirm that the most equitable society are the most just and those that will be able to face the pandemic more effectively.
Very good. I think this is an important lesson. Most equitable societies are the most just. And I think, again, in your answers, you demonstrated that issues of equity have to be built in the design, as Pablo said, and on the ground. So you basically elucidated through that value chain how equity has to be incorporated through every step of the way, from design to delivery. Let's move now to the question of accountability. We know that a lot of money has been poured into confronting the COVID pandemic. And this is likely to continue and even expand with the purchases of vaccines, etc. Have you been at all involved in monitoring the purchases of the procurement of the goods that were done? And have you had any role in that particular process to avoid corruption and build accountability? Let's start with Pablo.
Yes, thank you. Yes, from Poder Ciudadano, we were the first organization in Argentina to start asking the state about the purchase of vaccines, the prices that were being negotiated, and the condition for their acquisition. Unfortunately, the answer to our question were negative, hiding behind confidentiality clauses. In any case, we continue our work together with other organizations, from asking for the publication of clear information on the reception and distribution of vaccines, which result in more and better information published by the government.
Thank you. Let's go to Marlon. Marlon, you're always in the middle.
Yeah. Thank you very much, Harry. Now, in terms of monitoring the processes, yes, we tried, albeit with so many challenges, and the biggest being lack of access to information. Actually, there's a study that was done recently that showed that only 1% of all the procurements done by the government agencies in Uganda during the COVID period, only 1% of the information is available to the public online. So much as we try to monitor the purchase of PPEs, to monitor the purchase of equipment and their delivery systems, we were mostly impeded by lack of information. And also I found out that during that process, the Ministry of Health, which was at the center of the COVID response in Uganda, mostly used direct procurement and emergency procurement, circumventing most of the processes, which even made it harder. But when we were doing background information, we would find that most of these companies were either related to big politicians in government or people who are well connected. But again, that problem remained. And even we've been waiting for the Auditor General's report in Uganda. The Auditor General is the chief government auditor. But even the Auditor General at one time was denied access to information on COVID expenditures. And this is an institution mandated by government. Then you can just imagine the challenge that we had as civil society accessing this kind of information. So we tried, but the challenge of lack of information impeded our work mostly.
Yeah, so we're seeing very similar experiences in Argentina and Uganda. What about you in India, Akila? How was it?
It was declared an emergency, a public health emergency, declared a disaster, a natural disaster. So everything was centralized in the government, in the union government. So very little access, except whatever little came out on the media of questions being raised about the integrity and the transparency. However, when it reached the governments, the subnational governments, and it reached the health centers, we worked very closely with the media to track what had reached. And very often they would reach, but there would be nobody who would be trained to use it. It'll get into what is called idle capacity, unutilized, unused. So a lot of that was taken to the media. The media asked many questions. That helped to also unravel, things that had happened prior to it reaching the health center. So we played a very catalytic role at that level. And secondly, whenever there were instances of gross misuse, misappropriation, wherever it came from, we ensured that there was an open, whatever, investigation, a response. Nobody tried to cover up. We are not sure whether the entire truth came out, but some checks and balances were definitely established. And that's one strength of CSOs that work with community.
Yeah.
You really can't be challenged beyond a point. I mean, you have to be accommodated to some extent. You may not be entirely, told everything, but you can't be snubbed or, not given a response to.
Yeah, I mean, clearly, you guys played, tried to shed light and to bring to open these issues that were happening in your countries.
Yeah.
Although you made a huge difference, you could have done even more if you had had more access to information on procurement and on purchases in general. Now that the governments are moving to the stage of distribution of vaccines, what are some of the challenges you're seeing now? And what are some of the recommendations you can make? So what are the issues that you're seeing now and how are they different? So let's start with you, Pablo.
Thank you. In addition to the need to guarantee vaccines for citizens, we need greater transparency in the acquisition of these vaccines. We need to know quantities, prices, when the vaccines will arrive here. And here the responsibility is joined of the state with the supplier companies, not only the state. We need to focus in both. Argentina was advancing after some scandals in a clear vaccination plan. Unfortunately, the shortage of vaccines caused by a bad negotiation or lack of availability makes that plan very slow. Today, finally, the challenge is for more vaccines to arrive and for these vaccines to be distributed and applied effectively.
But are you seeing a government willingness to share information with you more than before, or is it still like a closed box?
We are in a better moment than the last year. We have more information. Of course, we don't have, for example, the information about the contracts. So we don't know about when the vaccines will arrive or how much costs every vaccine. But we have more information about the process.
Very good. Akila, what about you? Is this question of this gap of trust between government and the population being somehow better addressed in this particular phase?
They're trying, Hali, but I think there are some things that have prejudiced that trust. One is the way the entire thing, the vaccine was brought in. There was many levels of controversy. And some of it could have been avoided. But more importantly, they did not expect such vaccine hesitation from the health system. The health system, the doctors, the nurses, many of them refused to get vaccinated. They didn't want to be put in the front. They felt that they were like guinea pigs or whatever. There was some sense of fear. That vaccine hesitation is definitely percolated down to the community. And while, if all of us are making an attempt to, reason it out for ourselves and for others and see it as a public health response, we are also, urging the government to be more transparent, to be more open, to be more patient, to act. There are deaths happening, to be more, to expose what happened, to, provide the reasons why, whatever vaccine after effects have taken place. So there is that conversation in the making. Now the senior citizens, fortunately, have broken that sense of fear. They've lined up. They've lined up in double numbers. And, they want to take the vaccine, whether they're 90 years old or 60 years old, it doesn't matter. The entire spectrum of old people have lined up there. So now we are hoping to see, a little more trust and confidence in taking the vaccine. And now with the second surge of the virus coming back, we are all very concerned that we are caught between the, it's a crosswire the epidemic is growing and the vaccine is not growing as fast as the return of the virus. So that is a big challenge.
That is a challenge.
And we will be playing an important role. The communities will be playing an important role.
Yes, and that's a challenge everywhere. But I think in a country like India, with just the sheer numbers, is just it must be one of the most challenging environments to work. We appreciate the difficulty. What about you, Marlon?
Yeah, thank you very much, Harry. Our vaccination program started in March, around the 10th of March, but the key issues that are emerging right now, one, of course, the whole issue of prioritization and equity, like I said a little bit earlier, that much as the plan in terms of priority was released, but it's not being followed. We are seeing instead politicians who are not ranking high in terms of the priority list now coming up. They're getting the shots ahead of the frontline health workers, but also the other equity issues in terms of regional distribution, in terms of the vulnerable groups, in terms of the marginalized groups. I think the whole issue is that we don't have a clear, equitable plan for the vaccination. Second, of course, is the whole issue of lack of transparency. We're only getting bits of information here and there, but we're not getting the complete information in terms of what the government is getting and where they are taking these vaccines to be distributed first. And also we need to know that Uganda, as a country of 44 million people, will receive the few doses of 864,000 doses for a population of 44 million. So naturally there is rationing of these doses. So there's a fear that the people who need them might not get them. But also the element of politicization has come in at different levels, be it in government or people in opposition. There have been a lot of disinformation on social media regarding the efficacy and effectiveness of the vaccine. Questions of why the president, for instance, hasn't taken the shot first, why it's the other people. So there's a lot of disinformation and a lot of questions regarding the entire program from both sides of the aisle. But also the issue that came up during the COVID when it had just started, the issue of government monopoly, government taking over everything and then getting overwhelmed at a particular time and then allowing the private sector health players to come in. We are seeing a similar scenario right now, and we're wondering why, for instance, government cannot allow the private hospitals, the private health players to be involved in this process from the beginning, than to monopolize the entire process and then get overwhelmed with time. Yeah, thank you, Harry.
I mean, I see that your roles in the second stage of vaccination, your role is changing, and your role is more, in addition to the sharing of information, your role is to deal with politicization of this whole process by governments and doubts about the vaccine. So you really have to respond in different ways to be able to fulfill your role. Now, we have 5 minutes left before we open it up for the conversation. So I'm going to go to each of you and ask you to be very quick. But if you have one piece of advice to give to your governments or to the donors or to the private sector, if it's just one, what would it be? Pablo, let's start with you.
The answer is very simple, Hadi. Transparency in purchase, equity in distribution, and planning in the application of vaccine. The work of and about the donors, the work of civil society was known for its quick and innovative response to a new challenge. It has been a hard year in which the objective of many of us have changed, and the line of actions have been deep. Such as the demand for transparency toward the states. Throughout the month, we were adapting our tools and budget to something that had to be addressed urgently. Without any doubt, having more budget and with the accumulated experience would help us to make our impact much more effective.
Yes, thank you so much. Let's go to Marlon.
Yes, thank you very much. I think to our government, my biggest advice to our government is that one, they should make this information available. Transparency is very key. people need to know what is going on. I think that will address most of the issues. Secondly, to our development partners, they have a very big role they can play, especially the international financial institutions. Most of the money, I think close to $1 billion came from the international financial institutions, the International Monetary Fund and the World Bank. I think they have a moral obligation to pressure the government of Uganda and to know how these funds are being used, because most of that money is actually going into planned corruption that is planned, budgeted for, and appropriated in form of classified expenditure. Because I mean, if you have COVID and COVID is the main war, why would you have so much money going into classified expenditure? So the donor community has a moral obligation to know how their money, much as it might even be loans, they have a moral obligation to know how that money is being used. Thank you.
Thank you, very helpful. Akila.
So don't wait for a crisis. Make communities an integral part of all your solutions. Don't start wooing them after a crisis breaks out. And definitely build greater accountability in the health system. The public health system, particularly in countries like ours, where there's such a large population of the poor. And please introduce what is called community monitoring of the health services. You can, start what is called small, strengthen watchfulness where it matters, and then scale it up to higher levels of accountability and, responsiveness. Thank you. That's it.
Thank you very much. I'm now going to open the conversation to Q&As. And I can see that we have quite a lot of questions already posed. Now, if you're interested to raise your hand to ask your questions, we can certainly do that too. But I'm just going to sort of pick up some of the questions here. Could the panel say something about possible government resentment or even resistance to CSO involvement? Let's start with you, Pablo.
Yes, there are always responses on the part of the government to the participation of civil society, but that shouldn't stop us. We are all facing the pandemic and no one can be left out. If the government does not like our participation, we have to insist more than they take us into account.
Yes, I imagine that, Marlon, for you, this problem is quite important. So how do you deal with that?
Yeah, yes, of course, we have had that challenge during the COVID response. Initially, government thought that they could handle everything on their own. So virtually all the other players were locked out, including civil society, were subjected to lockdown measures, and were virtually, most of them, not fully operational. So the whole issue of resistance and not understanding the role that we play has been a big problem that has been going on. But through engagement, we've been engaging them at different levels to show our value addition. But also we had, like, for instance, a local fundraising drive here in Uganda to contribute resources to the COVID response. And civil society played a critical role in terms of making contribution, in terms of supporting people in need, in terms of providing things like PEPs and even funds in instances where government couldn't reach, had no reach. So eventually the government came on understanding and appreciating the role that civil society plays. So we are there now. There's a much more better appreciation in terms of our contribution than essentially during the start of the pandemic.
So it's important to keep pushing. Akila, you as well, please.
So Halle, one thing we must remember, that pandemic has hit us. I mean, it's hurt all of us. The poor are constantly facing mini pandemics. And for the last 10 years, I mean, there have been crisis after crisis. This is, another one more crisis of a different proportion. But for the last 10 years, we've been building this trust and transparency in every operation. And when the pandemic broke, it became very clear that, actually the power equations turned upside down. The people were actually handling everything and coping with the entire situation. So yes, there is resistance, but what is that resistance in the face of all the challenges humanity is today facing? And I think people can now use this pandemic to actually set terms of their, in a relationship with governments. I don't know about CSOs, but people as a whole can, because they are really integral to any kind of what we call regrouping or recovering or any kind of move towards prosperity. If of it, it's not possible without people.
Yes, I think it's important to put that people element.
I think,
yes. Yeah. We have another interesting question, which is about coalition building. So did you, in your experience, to be able to break through the issues the challenges that you faced, did you build coalitions with, for example, the media or yes. other to bring about change and to influence government? Akila, let's start with you.
Yes, all the time, Halle, even in the best of times. And now, of course, it goes without saying. It's also because resources are scarce, and the kind of travail and misery that people are in still is enormous. So without a coalition, without everybody coming together, forgetting all their labels, their silos, their brands, etc., unless they come together, nothing works. So there is a constant banding together now on every issue, whether it is a crisis or it is a coping with the existing challenges. So coalition is integral. There is nothing called a singular civil society organization. It's all big platforms now.
Marlon, for you in Uganda?
Yeah, thank you very much. At the start of the pandemic, everyone was mostly inward looking. They were looking at their own survival as institutions. But as we gradually came out of that, the coalition started emerging. But I must say that the coalitions were mostly within civil society organizations that had a thing or two that brought them together. But across with media, they were not so much, or private sector, they were not so much, or they were mostly within civil society, but working closely with individual media institutions and private sector players. Yeah.
So coalitions are really important. Pablo, for you as well?
Yes, we work a lot with the media and especially with our organizations. We believe that it is the only way to do it. And especially the media are our main partner in reaching people. That it's our final objective, and they are doing a very great job.
Mm-hmm. Super. There is one, maybe we have time for one last question, and then we're going to pass it on to Vinay to give us a summing up. And that question actually very interesting. It says that government is not uniform. Government has different parts to it. Some are more collaborative, some are less collaborative. Do you, in sort of developing your strategy for how to deal with government, do you categorize governments in different things, and do you have a different approach for dealing with those different categories of government? Akila, with you, let's start with you first.
It depends on the issue, it depends on the kind of struggles you're facing or the kind of issues you're confronting. Yes, at many levels, that at the policy making level, they have one set of preoccupation. But at the operational level, they really appreciate any kind of, support, assistance from the civil society. So we build on that goodwill there. And with the community, we build the goodwill before we go to the policymakers. Because the policymakers have their own, what is called a hierarchy. They have their own hierarchy of, both priorities and what they perceive as important issues. But for us, what matters is the people who actually provide the service, who are actually at the cutting edge of delivering things. So we actually, place much more effort in winning their goodwill over and their support over.
Thank you. It's have to be practical and opportunistic. Yeah. Marlon, for you.
Yeah, thank you very much. The question of whether government is collaborative or not, the institution, depends on who heads it, their perceptions, their biases, and their previous experiences. So we approach each using different approaches. You'll find that when you approach an institution of government that has a more responsive leader who is much more open to discussing issues of transparency and accountability, you will have a quick through. You will find that issues are coming much easier and you work together quite well. But when you find other institutions where the head has a bias, especially on civil society or in a particular institution, you'll find challenges. So that dictates the approach. Where we find that the leadership is much more willing to collaborate with us, we use a collaborative approach, partnership, collaborative approach, working together. But where we are not welcome, then we become combative. We use things like the media, start doing undercover investigations, exposing them, naming and shaming. And eventually that approach leads into dialogue. Even the combative approach eventually leads into dialogue, especially when these issues are put into the public. So true, I agree that we use different approaches depending on the circumstances and the nature of the institution that we're dealing with. Thank you.
Pablo, how about you?
I don't know if I understand the question very good, but we have the advantage in Argentina that the facing of the pandemic is centralized in a national government. For example, if we are thinking in the province or the state, how they face the pandemic, and the purchase of respirators and vaccines are made from the central power, and the work is quite coordinated. The approach to working with the government has been good, but it has taken a long time during the last year. But we have finally advanced on a pretty oiled year.
Yes, very good. Thank you so much. Maybe just, I said that was the last question, but Vinay, maybe we have time for one quick one, which is my own question to you. We are going to be seeing a lot of probably additional money going now to the vaccinations and the whole health sector reform, etc. in your countries. If the donors are willing to provide more support to you as the CSOs who are going to accompany this process, what will you do more? I mean, if you have more access to more money, what would you do differently and more? Akila, to you.
Do differently on the vaccination or on the entire health sector?
No, I think there is going to be a lot more money going to the entire health sector and including the vaccination. So what would you do if you have access to more money?
I think the first thing I would do is what you call community strengthening, a system strengthening, which is purely technical, medical, clinical, to some extent administrative, will not suffice. You have to have community system strengthening, where you have proper sort of not just educators and motivators, but actually acting like trained frontline leaders that are able to raise confidence, are able to make the system responsive, sensitive to the needs of the community. They're poor and they're very challenged day after day, and the pandemic is not easy for them. They've lost their jobs. All of that has happened. They've been dislocated. So I think to build what is called a community system strengthening, and one of the solutions that we offer is what we call a single window. It's a supportive single window, which is staffed by the community, but located in the governmental system. And they act like a, shall we say, interlocutor between the community and the system. They have to take that seriously. They cannot push all this down as soft issues, not important issues. No, people matter. Their psychology matters. Their confidence matters. Their inner courage matters, and that should be recognized. The pandemic is challenging that, not your frontiers of science alone.
Absolutely. Absolutely. Thank you. Marlon.
Yeah, thank you very much. One, we have to push for accountability, especially for the unaccounted for funds. In Uganda, I've talked about 91, but I know it's much more than that. Since the information is just coming up right now, we can not just let this money go without questions being asked. And we're also looking at the possibility of private litigation, taking some of these officials to court because we know some of them, they're building hotels, they're putting up apartments, they're building different infrastructures from this money. So something has to be done about that. Secondly, of course, we cannot rule out the whole issue of dialogue between citizens and their leaders to ask the hard questions, because most of the leaders have been hiding under the COVID prevention standard operating procedures, no dialogues, no kind of like community hall engagements. But I think it's high time that we start thinking about this, ask the hard questions. Then, of course, the whole issue of equity. There are groups that are quite need to be considered, like the marginalized groups for instance, like the Karamajong in the northeast of Uganda. We have the refugees who are not being considered. I mean, the whole issue of equity has to be put at the forefront. Then, of course, supporting citizens to monitor where possible. And then, of course, lastly, but also quite important, is the whole issue of countering disinformation. Because the uptake of the vaccine, besides the elite, among the citizens is quite low. So there's the whole need of to counter the disinformation that is going around.
Thank you.
Thank you.
Pablo.
Without any doubt, having more budget and with the accumulated experience would help us make our impact much more effective. We are in a position to take a step forward from what we have learned, but also from the experience that the government have in handling the pandemic.
So to any donor agency listening here, I think it's you will see that the partners that have been presenting, the CSOs that have been talking to us, not only have made a difference, they've saved lives, they've saved money, but they could have done more, and with more resources being allocated to them, they already have a very clear mind as to what they could do with that extra money. So it's an encouragement to whoever is listening to provide more support, especially those on the ground. So I would like to now bring, I think we are almost at 3 o'clock here where I am, and we're going to bring this to a close, and I'm going to pass it to Vinay for some final thought and summary of what we heard from our panel.
Thank you very much, Hale, and this has been a fascinating and very, very substantive and informative discussion. I think we had reports from 3 continents, but there are some common elements in them. More than anything else, they are good evidence that the civil society organizations have the capacity and the experience and the willingness to engage in improving the equity and governance of not only the COVID-19 vaccination and responses, but in the health sector service delivery, as several of you, including Akila, mentioned. It's hard to do justice to this rich discussion. To summarize, I would not even attempt to do that. I will quickly highlight 4 points. But very quickly, there was also a question from Judy about are there transparent guidelines for prioritization for vaccination? And the short answer is yes. I think almost all countries are publishing this transparently, because WHO, they are all following WHO guidelines, and this is almost a precondition for any financial support from the world community. So the real issue is not whether they are publishing transparently the guidelines, but will they comply with them? That's where the problem comes. Now, the 4 points I wanted to mention. The first, I already mentioned that civil society organizations have the capacity, the experience, and their ability to make a difference in improving the equity and governance. The second point is that the government has a job to do to create an environment for civil society. This was a point you raised as a question. Very quickly, 3 examples here. The government of India, right from the beginning, issued letters and calls to civil society organizations to come and engage with not only COVID-19 response, but also vaccination. But to my knowledge, they have not put any money into funding the civil society work on this. This is being done by civil society's own resources. contrast that with Mongolia, which has just received $50 million from the World Bank for a population of 3 million people to vaccinate them. And this government of Mongolia has gone all out to take a part of that money and has promised to fund the civil society organizations to do things like profiling of vulnerable people and registering them and bringing them to vaccination centers, ensuring vaccination coverage is increased, ensuring that communities cooperate. So Mongolia is an example of a progressive government which is not only saying the good words about civil society, but is backing it up with money and taking the money from the donors and funding the civil society organizations. Of course, this is on paper so far, but it's a good step forward. And third is the Philippines, which has received about $1 billion from Asian Development Bank, the World Bank, and the Asian Infrastructure Bank. And Philippines is known for its vibrant civil society sector. But as far as I can read all the documents, the government of Philippines is not planning to put a single cent into funding the civil society work in this area. So it is a great missed opportunity, and this is very sad that they are not doing it, and this will hamper the effectiveness of their program. So these are the three examples. So governments can create the environment. There are examples, good and not so good examples. And the donors, as was mentioned by Marlon, have a key role to play in this. And the final point I want to make is that the working together, the government and the civil society is very important, because as I said in the beginning, governments alone cannot do it. Even when before the pandemic and the humongous crisis it has generated, this was well recognized in Agenda 2030. Governments cannot do it alone. They need to partner with civil society and private sector, even more so now. That is extremely important to do that. And the civil society has a responsibility to collaborate with the government to make service delivery better and serve their communities better. At the same time, not abandon in their watchdog role to verify that the government is performing. So trust and verify, as I said earlier, is extremely important in these times more than ever, given the huge amounts of money which are being involved. So let me stop there, Hale. It's not a summary. It's difficult to do justice to the extremely good discussion. I want to thank all the panelists and all the participants for a wonderful session. Thank you. Over to you.
Thank you, Vinay, and thanks to all our participants from all over the world, to our fantastic panelists, not just for participating so nicely in the session, but also for the great work that you're doing on the ground. I think the one message that you all conveyed with a strong voice is that a partnership between government and CSOs will make the impact of government's work better and bigger. And so it's an encouragement for governments to continue to support and to expand their support to CSOs in this area. And we at PTF certainly stand ready to support you, to collaborate with you. We're one of you, and we're learning from each other and supporting each other in trying to help the plight of the most vulnerable together. So very big thanks to all of you. And we hope to similar sessions in the future. Thank you so much. And thanks to the OECD for hosting us. Thank you.
Thank you. Thank you too.
Thank you, Harry, and everyone.
Thank you. Thank you very much. Thank you.
Thank you.